So thank you very much. My name is Mundell-Noel, and I am, as George pointed out, the audiologist at Ultimate Hearing. A little background on myself is I have been an audiologist for over 30 years. Really, can you close the door? We're getting a little noise out there. Again, I have been an audiologist for over 30 years. I have my undergraduate and master's degree from Michigan State University. I'm a Spartan. And I moved out to California. I had my own private practice for 10 years, from 1989 to 1999. And in 1999, a company sought to buy my practice. At the time, I had 3 children, 3 boys that were 2, 3, and 5. And so I sold my practice to raise them. And my youngest son, Matthew's over here on the camera. And I stayed home with them for 12 years and raised them. And then I came back. I went to my old office for 2 years to get back up to speed. And then for the last 3 years, I have been on my own at Ultimate Hearing. So I love what I do, and I am excited to be here this morning. Again, I want to thank you for battling the rain and the time change. I'm sure some of us are a little bit still sleepy from that change of time, but I'm very thankful to be here. I also want you to know that we are filming this morning, and that is because I gave this talk last Tuesday in Laguna Woods, and I had an overwhelming response of people asking if I could please video it so that they could go back and refer to it. So we are videoing today. Your faces will not be on, maybe the back of your head occasionally, but don't worry, we won't have your faces on the video. But the purpose will be to put it on YouTube for further reference, because there just is not enough information out there as to why you're having the trouble that you're having. So that's what we're going to address this morning. Before I start, I want to make sure, did everyone understand what Tony was saying about the T-coil? So the way the T-coil works is that there is the wire around the room. And normally, if I'm talking in a microphone, the people sitting up front have an advantage, right? Because the sound is traveling from the microphone or my mouth, and it dissipates or it gets softer when you go to the back. Today, that is not an issue if you have the T-coil, because the wire that is around this room is picking up the microphone voice through the electromagnetic material in your hearing aid. And so it's equally being distributed. So the people in the back of the room are hearing the volume of my voice the same as the people in the front. So see, you didn't have to come so early. The advantage, though, of sitting up front is that you get some visual cues. Normally, we would have closed captioning up on the screen. But because I'm slowing my voice down a little bit, we thought that everyone should be able to hear and understand pretty clearly what I'm saying. Is that the case? Is anybody struggling?
Yeah. If you could repeat if they put their hand up.
So if you're struggling to understand me, you put your hand up. Everybody's doing okay? Great. So let's get into the topic, communication. I am going to use this handout right here, so if everyone would pull this out. And Pearl, what time are we going to go till? 11:15?
Does anybody need a copy?
No. Are we going till 11:15? No, I need the time. What time are we going till? 11:15? Okay. Okay. So we're going to go with this. And what we're going to do is I'm going to start out with what is normal communication. How does normal communication happen? And the reason I'm going to start out with normal communication, even though we all have impaired communication abilities in this room, is because just like when they are looking for counterfeit dollars, do you know how they find them? They train people who are looking for counterfeit dollars by having them constantly feel the real thing. So as they're feeling the real thing, and they're getting used to that, and they have that in their mind, when they encounter a counterfeit dollar, it's very easy or much easier to discern, oh, that one's counterfeit. So in the same way, what I want to do is I want to start out today with normal or good communication. And I want you to understand that there are a lot of factors that come into play. So first, we have the sender. This morning, I'm the sender. I'm sending you out a message. So when we look at that, some of the major issues that a sender has, or some of the major components of sending the message, would be the volume, and we've corrected that today with a microphone, the speed, how fast somebody speaks. So if I slow down a little bit, it makes it a little bit easier for you to understand. The pitch. If I'm a higher pitch or I'm a lower pitch, both of those things come into play when we are delivering a message. The timing. By timing, what I mean is where we put our inflections. If you have an accent, we all know that people from New York have a harder time being understood on the West Coast, even if they've lived here for many years, because their timing of how they produce a word is different than what we have been trained on the West Coast to interpret. So even though they're delivering the same message, if I just kind of draw out my R's, I'm not a West Coast or an East Coaster, but you know, I'm from Michigan, and I can say my mom and my dad, and I go out and about, and people go, ooh, that's different, right? You can tell that the timing issues come into play. Other things that affect a sender could be that obstruction. If I put my hand in front of my mouth, if I have facial hair, if I have gum in my mouth, all those little things that we don't even take into account naturally do become a part of the communication process. And the last thing is enunciation. If the kids today kind of slur their words and don't really talk a lot, you know, they kind of change, sorry sweetheart. But if they don't enunciate, if they don't give all the diction that you would prefer, it does make communication more difficult. Would you agree?
Yeah.
So the next thing is as the sender, I'm sending you the message, and the message has to go to the receiver. So you guys right now are all receiving the message that I'm sending. Usually, distance is a factor, right? If I'm sitting close, you should hear the message better than if you're sitting 15, 20 feet away. We've eliminated that today because of the loop and the microphone, but oftentimes that is a factor. The acoustics of the room. We have carpeting on the floor, the tile, whether or not you have vaulted ceilings, whether or not you have hard floors, those become factors. Think of today's restaurants, right? What are they? Hard, brassy, reverberant rooms. There's very little fabric for absorption of the sound, and it makes communication much more difficult. The reason that restaurants do that these days is because the louder the ambience in the room, it has proven statistically the faster you eat, and the faster you eat, the quicker they turn that table, right? So they're trying to get you out. They're not trying to go to the old days of sitting and relaxing and enjoying a meal. They want you in and out. Other things that can be an issue with receiving the message can be the time of day. Now, how could that be a factor?
Tired.
It could be that you're tired. How about shadows on your face? You don't realize, but when the sun comes down, it can cast a shadow and can change the way that you are doing your lip reading. And then environmental factors. There can be outside noises, the wind, even this morning, the rain. Things that come into our environment that we don't even realize have an effect on communication. So now we're going to talk in normal communication. This is not even having a hearing loss, but this is with everyone who receives a message. What are the things that affect you when you're receiving the message? Well, the first thing is readiness. Are you ready? So I'm going to ask this morning, are you guys ready for the message? Right?
Yes.
Have you mentally made your brain available? Are you alert? Even though we had the time change over the weekend, are we alert? Have we had enough coffee? Attention level. Are you going to pay attention? We know that there is definitely a difference between hearing and listening. Our kids hear us all the time, but they sure don't always listen, right? Cognitive level. Do you know the topic? If I'm talking and I'm going to use words this morning that you are familiar with, then you will have better communication. You won't have to think about the words that I'm presenting. So that's why you have a visual handout, is because the more information I can put in front of you and prepare you with, the better your ability to receive the message. The memory level. Can you remember? How is your short-term and long-term memory? Those are all things that affect everyday communication that we don't even really think about. Our age, right? Little children talk in incomplete sentences, and they don't have the retention level, and they also speak very rapidly and very quickly. That is a factor. When we get older, we don't process as fast. And so as we're older, our ability to receive the message becomes less. And then physical health factors. We don't really think about this, but if I'm in a walker and I'm down here, I'm not really looking up, and so the message is not always received the same as if I'm upright. If you're in a wheelchair and you're lower and people are speaking, the message can oftentimes go right over your head. So things that we are not really aware of are very big factors in communication, even for normal listeners. We haven't even started to talk about hearing loss and what that affects. But I want you to be aware that there are a lot of factors for communication. Okay? The next thing, any questions on that? Everybody pretty clear about that? The next thing I want to go through is I want to go through a normal ear. So what does it look like for normal hearing? And I recognize in this group we have talked a lot about hearing and the anatomy of the ear. So I'm not going to go through that a lot, but I do want you to be aware of how the brain receives the sound. So if you look at the bottom of your diagram here, the first thing is, and the words that I'm going to use are in the dotted box, but the first thing is the outer ear. That is something that collects the sound. So we have the pinna here collecting the sound, and it goes to the eardrum. So the sound that's being collected is acoustical. So you are receiving an acoustical sound that I'm sending out. You can't see it, but there's sound waves going through the air that are going into your ear and hitting your eardrum. Your eardrum then, when it gets hit with the sound, it starts vibrating the three little bones in your middle ear. So when you look in the section right after the eardrum, there's three little bones, and that is also where your eustachian tube is. So the outside is to collect the sound, the middle ear is to transmit the sound, as well as equalize pressure in your head. So when you go up in the mountains, or you go down scuba diving, what happens? We need to pop our ears. And the reason we need to do that is that tube, your eustachian tube, is equalizing the pressure in your head. The other thing that's happening is that sound is going from being an acoustical sound to being a mechanical sound. So it's hard to believe that the sound waves this is all happening right instantaneously because you're understanding me. So this whole process that's going to take me 10 minutes to tell you about is happening like this. So the sound comes in, it gets collected, the eardrum vibrates, it hits the three little bones, the hammer, the anvil, the stirrup, and the stirrup at the end of it, it looks like a horseshoe, if you remember your anatomy from high school, and that little stirrup is pushing in and out, right, just like a mechanical system, and it's vibrating the cochlea fluids. So the thing that looks like a snail is called the cochlea. That is where the electrical stimulation actually happens. So when the sound comes through, the thing that looks like a snail is actually receiving the message, vibrating the appropriate hair cells in there, making the electrical impulses, sending it up to the brain. Isn't that amazing? Now, does anyone know the size of the cochlea? For a couple of you that were at the other meeting, you can't respond.
2.5 inches.
She says 2.5 inches, okay? Anybody wanna take another guess? The cochlea is the size of a pea. You think of a pea, not even the tip of your fingertip. All the hearing and transmission, all our comprehension and understanding is being done by an organ that's the size of a pea. Now that's pretty amazing. So what is happening is the sound comes in, right? We're collecting the sound, we're vibrating the 3 bones, and the fluid in the hair cells is vibrating back and forth. And when it does that, there's nerve endings that are hooked up to that, and those nerve endings take the message from the auditory nerve up through the inferior colliculus, and then through the superior olivary complex up to Heschel's gyrus in the brain. So if you look down here under inner ear, it's the receptor, the transmitter, and then the auditory nerve takes it all the way up to the brain. This is called the bottom-up approach. The sound is coming up, and it's going from outside up to the top of the brain. Now we have the message that's in the brain, and it is located in the temporal lobe. That is also where all speech comprehension takes place. So we know people who have had strokes, right? That portion, that temporal portion, is where the sound is coming up, and the brain then has to code it. So when you have a stroke, the coding ability is not there. It's been damaged. And we'll talk about that a little bit more in the future. So the normal process that's happening is the bottom up. It goes to the top of the brain, and then it starts the top down approach. So the brain, if we flip to the next page, we're going to start talking about the brain and its processing. So the purpose of the brain then is to recognize, orient, separate, and focus. So when it recognizes the sound that came from the outer ear through that pathway up to the top, now the brain has to recognize that sound. And the sound is coded. We apply meaning and interpretation, and that's how we get understanding. So that's point number 1 under there. If I were to say to you, "Isto duma spacztiko pustogłowa," okay? I don't say it very well, but is anybody Polish in the room? No? Yeah, my son. He knows what I said, but what I said in Polish is "go home and go to bed, you cabbage head." It's one of the few things that my grandma taught us in Polish. Why she taught us that, I don't know. But the point is, you heard it, you tried to encode it, but because you didn't have the right tools, you didn't understand it. You didn't comprehend it. But the system worked. The message got through to the top, so the bottom-up approach worked, but the top-down for understanding did not work because you didn't have the meaning or the tools behind it. So when we listen to something, if we don't have all the tools available to us, we don't always understand or comprehend. Does that make sense? Okay. So when you look at the brain and the processing, it wants to recognize a sound, it wants to orient itself. Where is the sound coming from? It wants to localize, and that takes 2 ears instead of 1. We can hear a sound with 1 ear, but we can't truly localize with one ear because the system is made to be balanced. We're made to hear from both sides. When it comes from one side louder than the other, even though the sound crosses over our face, which is called the head shadow effect, when that happens, the brain says, ah, louder over here than over here, I know the sound came from that side. So when you have, I know a couple of people who have unilateral hearing losses or have a dead ear, they will tell you it's very hard to localize to a sound because you always want to turn to the strongest side. And that's one of the things that the brain does. Another thing that the brain wants to do is it wants to separate. It wants to separate the words from the background noise. And that is something we all would love for it to do better, especially as we experience hearing loss. And we're going to talk about that a little bit in the next few minutes. But it wants to separate out the words from the noise so that you can hear the words through the background. The last thing that the brain wants to do is it wants to focus. It wants to come in, zoom, use all the clues that you're giving it, visual and auditory and memory and sentence structure, and it wants to focus on the message. And this again is all happening instantaneously as we speak. So the reason I go through how this normal system works is I want you to understand there are some factors that you can control and some factors that you can't. And the ones that you can control, we want to encourage you to do them better or to be aware of them so that you can help yourself. Because some of the factors when it comes to hearing loss and the understanding, a hearing aid is an aid. It's not a cure-all. And although hearing aids are getting smarter, they cannot replace a lot of the factors that impair good communication, okay? So we're gonna get into this a little bit deeper now, but I want you to understand how normal communication works, all the factors that are available or need to be present in order for it to happen effectively. And I want you to understand how the normal ear system works. The ear is the most sensitive organ in the body to blood flow. And the reason is because that tiny little organ, the size of a pea, the way that the arteries and veins go into that organ are very much affected by blood flow. And so, as we get older, we have hearing loss in America because we get older. And we say, well, it's a part of the aging process. Not necessarily. What we have found is that other cultures who have better eating habits, who exercise more, who their blood and oxygen flow is better, don't show the signs of hearing loss that we have in America. So what that means is when your doctor tells you to exercise more, drink your water, eat your greens, he's doing it for your health. All the things that we know we should be doing, but we don't, are a factor. So one of the things you can do best for yourself is to exercise, drink your water, and stay healthy. The more you do it, the more alert your brain is, and if your brain is alert, what happens? Better understanding and comprehension, right? So, also just remembering that medications do play a portion in your comprehension skills. And you say, well, how does that happen? A lot of medications, especially for high blood pressure and heart and diabetes, all thin out the blood. Or they can cause a vasoconstriction, right? The biggest thing that they do is they thin the blood out. And if the blood is thinned out, it's not as oxygenated. And if it's not as oxygenated, the little hair cells inside the inner ear don't get the blood flow that they need, and they die. So that is why with aging, we have hearing loss. If I took the little cochlea, the thing that looked like a snail, that looks like this on your paper, and I unrolled it like this portion that's closest to my body is where the high frequencies occur in our hearing. And down here by my fingertips, low frequencies. So when I roll it up like this, the low frequencies are kind of tucked inside. And then if I go like this, the very high frequencies are here. When we have hearing loss, what area of our ear is usually affected first?
High frequency.
The high frequencies, the ones right here. So why do you think that the high frequencies would go first? Anybody want to take a stab? Why would those high frequencies go first? They get used the most, right? Doesn't matter if I have a low frequency sound or I have a high frequency sound, the stapes, or that stirrup, is hitting these hair cells first. And the sound has to flow, and it will go to a certain place on the cochlea to stimulate it. But what they feel is one of the theories is that the hair cells, the high frequencies, are constantly being stimulated, whether or not it's a high frequency sound or a low frequency sound. So they feel that it's kind of wear and tear, kind of like your carpet going in your house, right? Even if I want to go to the bedroom or the kitchen or the family room, I walk in the door and that pathway gets worn. Even if I didn't mean to stay in that room, I still have a worn path because I had to use that in order to get to where I wanted to go. And in the same way, the theory is that the high frequencies get damaged first because of the amount of use and wear and tear that they experience. There's some other factors that play into that, but that is the most prominent theory. The other thing is the way that the hair cells are embedded into that cochlea. There are hundreds of thousands of inner hair cells, which are inside the middle of the cochlea. So if I hold my arm out, they would go down the middle. Then there's outer hair cells that are, guess what, on the outside. And they hold the inner hair cells in. The inner hair cells are the ones that carry the high frequencies or the clarity more of speech. And so when the high frequencies start to get damaged, it's not that big of a factor in overall comprehension. We start to lose a little bit of the clarity of speech, but we still say we can hear. And the reason is those hundreds of thousands of inner hair cells have a bundle of nerve fibers underneath supporting them. The outer hair cells, which carry the volume and the pitch and some other aspects of speech, they do not have as many nerve fibers connected to them that are sending the message up to the brain. So when the hearing starts to go down in the lower frequencies, we start to experience more of the components of comprehension and understanding issues. And we'll start to talk about that right now. But know that that cochlea, that thing that looks like a snail, has a huge impact on how we comprehend and understand. The way that it is damaged is critical in what we understand and want. So, you had a question?
I had a question. I don't know if I'm right in asking you this question at this time. But as far as hearing aids are concerned, what if you have tinnitus?
Okay, so I won't talk about hearing aids, but thank you for talking about tinnitus. Tinnitus or tinnitus, both pronunciations are correct. And what tinnitus is it's a sign, usually, that there is hearing loss in the ear. We know that tinnitus is a brain phenomena. It's something happening in the brain. It is not happening in your ear. People who have tinnitus, if you're not familiar with it, it is that they hear a ringing or a buzzing, usually in their head. It's like, ee! And it can drive some people to commit suicide when it's that dramatic and it's that constant. And so what they have done in studies is they have severed that auditory nerve, thinking, okay, we'll get rid of the tinnitus. Guess what? It didn't go away. So now they cut off the hearing, but they still have the head noise. So we know that the tinnitus is coming from the brain. And what the theory about that is that the hair cells in the inner ear are damaged. That message is still coming through, but the brain is not receiving it correctly. Instead, it picks it up as ringing. Some people hear voices, but what we understand is that there's extra energy in the brain. So ways that they are correcting that in today's technology and hearing aid, almost every hearing aid has a tinnitus program in it. What it does is it puts extra sound into the brain. They have something that's called fractile tones, and it's a non-repeatable pattern. Ching, ching, ding, go, go, that goes in the background, and it gives the brain something to do. So it's kind of like having kids, and we have to direct their energy, and if you don't direct their energy, they're going to make a lot of noise. So what we're trying to do is we're trying to give them more things to do so that they don't focus on the one pattern. It's the same thing that they're doing in pain management. When you have pain and it's radiating from the brain to your arm, what they do now is they give you what's called a TENS unit, and they will put stimulants all over your arm so that the message or the stimulation is all over, and the brain doesn't focus on the one pattern, but now it has many different areas to focus on. And the same thing is happening with hearing. We're giving the brain a lot of extra sound so that it doesn't focus just on that. So the short answer is it masks it or covers it or fatigues it. There's lots of different theories on that. But the bottom line is during the day, even wearing a hearing aid can oftentimes have the tinnitus be diminished or you forget about it because now the brain has other things to do. But at night, when you take the hearing aid off, it's there. But oftentimes you're so fatigued during the day that you can kind of forget about it. But some people will even put a speaker underneath their pillow to keep the brain stimulated for sound. So thank you for that question. Okay, so we've gone through, right, our communication, the sender, the message, the receiver. Does all communication have to be verbal? No. If you're driving and you cut me off and I, want to give you a hand signal, okay, that is communication. Not necessarily, sometimes it's effective, sometimes it's not, but it is communication nonetheless. So I want you to understand that communication can be verbal and it can be nonverbal. And we want to try to use all of that to our advantage. Because as you know, when you have hearing loss, those factors, now that we're going to lay a hearing loss over the top of everything that we just talked about, now there's going to be an issue with every aspect along the way. And so what we are trying to do is to encourage you to know that some of the things you can correct on your own, some of the things you can now be aware of to help yourself with communication, and some of it, unfortunately, is going to be out of your control. So the purpose is to maximize what you do have in your control. And you have yourself as the person sending or receiving the message, as well as the hearing aid. You can go behind me if you need to. As well as the hearing aid to help you with that communication. So let's go to the next page. How the brain is affected by hearing loss. Okay, so the first thing is impaired sensitivity. So what I mean by that is your ear is not as sensitive to sounds. Just don't hear them as loud. And so we all know that that's the first sign of hearing loss, because what do we want to do? Turn the volume up, right? And most of the time, it is the high frequencies or the clarity that starts to become affected first. So if you look at your audiogram there on the right, You have normal hearing, mild, moderate, moderately severe, severe, profound. As you go from the top down, the hearing loss becomes greater, but also the effect of the hearing loss. The items on the left-hand side start to be more present. They start to accumulate. They have an additive effect. So when you first start with a mild hearing loss, it usually is on the right side of the graph. It usually is just affecting comprehension. Our clarity sounds like S, F, SH, TH, C, T, P. Those sounds that give distinction are usually the first ones affected. So what we find is, did you pick up the dish or did you pick up the fish? Me, knee, chew, chew, right? We hear it, but we don't always understand it. So what happens is the first thing we do is we turn up the volume and it comes back. We give the brain enough information, it will come back. But other things that start to become affected as your hearing loss starts to go down the chart, altered loudness perception. So what that means is that I turn something up a little bit, didn't really hear any difference. I have to turn it up more for you to hear the subtle differences that a normal listener would hear. And again, these are things that are happening physiologically in the brain. These are things that you don't have control over. But what I want you to know is that they are happening, and so it makes sense when you are frustrated and not comprehending, because physiologically these things are occurring. Impaired frequency selection, where we can't distinguish. The timing cues become more of a factor. If I say, do you have the time? And somebody says, no, I don't have a dime, right? We all laugh at that, but that is not a laughing matter. It hurts when we don't comprehend or get the right message. And know that it's happening because physiologically the brain is not receiving the same stimulation. When you have more hearing loss, more of those little hair cells in that cochlea are being affected, and the message isn't being transferred as efficiently as it previously was. So kind of to give you an idea, it would be like a radio, right? If you have a radio and you're trying to send a signal, we all know what it feels like to have a little bit of that static in there, and we're trying to get it right on cue. But sometimes the message just isn't strong enough and we don't get all the pieces. That's kind of what's happening physiologically in your brain. Your brain is trying to receive the message being carried by the ear, but it's not doing it effectively on its own. And so these things all become more prominent, and you are aware of them. This is the group that is experiencing the issues, because the more your hearing loss goes down the chart, the more these things come into play. And then the more heavily you rely on your hearing aid. But I want to remind you that the hearing aid is an aid. It's not a cure-all. And so as the hearing aids become smarter today, they are trying to do all these things. The research and development in hearing aids is amazing. They are trying to change the sensitivity. We want to make it loud enough for you to hear it. We are changing so that we don't make it too loud. They're trying to make it so that you can distinguish the difference between different sounds that you can't on your own. They are trying to work not to make it too loud and too soft. They're trying to pull it from the background noise. So all these things that are happening physiologically that your body is not able to do, that hearing aid is really working to try to do it better. So I know you say oftentimes, well, it still doesn't work. Well, unfortunately, physiologically, the body is not able to do its job like it was. So that's why we're going to go back and look at all those other factors that we can control. And what we want to do is we do want to make sure that the hearing aid is doing the best job possible that it is set correctly, that it is adjusted to the maximum performance, and then what we have to do is let you and your body do the rest. One of the things that we do know, though, is that support helps. I gave you an article that about the social effects of hearing support, the benefits of social support for listeners with hearing impairment. You guys are doing exactly what you need to do. You're coming in, you're getting information, you are talking to each other about your hearing loss, and you're recognizing that you're not alone. And I commend you for that, and I want to encourage you that the more you talk with your family and friends about your hearing loss and working to improve communication, so looking at those 3 areas of communication and how to maximize them will help. It will help. So, going back to how the brain is affected by hearing loss. We talked about impaired sensitivity, the things aren't loud or soft, perception, you can't tolerate sounds as much, impaired frequency, you can't distinguish. The next one is altered intensity resolution. That is that you can't distinguish changes in volume, very minute changes. Some people have just the opposite. Their ear becomes hypersensitive when it gets damaged, and that is a very difficult issue to have because everything becomes too loud. I can turn it up a little bit, but to them it's like I've turned it up 20 steps. So you may know somebody who has that hypersensitivity, but for most of us, when the hearing loss starts to go down the chart, we have trouble distinguishing those volume changes. Reduced temporal integration, what that means is that your ability, when people speak really fast, is that you can't pick them up very much, right? So now we have some background noise, right? We're trying to hear the voice over the noise. But we have temporal integration, means that you need someone to slow down, and it makes it easier, right? And because when you slow down, it's giving your brain more time to process because its ability to process is not as good. So if I slow it down, it gives you more time to think. So as you're talking with your family and friends, and they start talking more rapidly, what is the first thing that you say to them? What? Right? What? Why do we say what? Well, we can't hear, but what does the word what do for you? It's a strategy. It gets them to stop talking, right? If they stop talking, because you said what, they have no idea what. But they'll stop talking, and oftentimes just that little break is enough for you to catch up. The other thing I want to say on the side of the receiver, right, you are the receiver, is that sometimes when you say what, you really heard the message, but you want them to slow down, right? But sometimes when you hear the message, you didn't really hear it. You didn't understand it clearly. And when you say what, they stop talking. But if I'm the sender, and I sent you a message, and you said, what am I going to do?
Repeat.
I could repeat. I could get mad. What part didn't you get, right? When you say just what you're saying to the sender is stop. Okay, they're going to stop, but they don't know what you got and what you didn't get. They don't know if I got everything but the last word, or I didn't get anything that you said. So as the receiver of the message, one of the things you can do is you can give them some information. Tell them what you heard. Where did you say you were going? What did you say you wanted off the table? No, I didn't say I wanted anything. I said I was going to the store. Oh, okay. So again, that communication of you as the receiver, even though the message is not coming in as clear as you would like it, and you have a strategy to stop it, one of the things you can do to improve the communication is to give more information. And by you saying, I'm sorry, sweetheart, I didn't understand what you said about, and you tell them what you heard, that does help improve the communication between you, because then as the sender, I recognize, oh, wait a minute, he didn't check out, he was trying, it's just that he didn't get all the comprehension. And that really does make a difference. Altered pitch perception is another thing that happens with hearing loss, and we know that children and women have higher pitches than men. So oftentimes when you have a hearing loss, little children's voices become more difficult. And no, it's not called spousal deafness when you can't hear your spouse. People will come in and say, he can hear everybody but me, you know, and it's like, no, women just usually have a higher pitched voice, and many men have difficulty understanding those higher pitches. Impaired localization ability, and we talked a little bit about that, the ability to hear with 1 versus 2, you don't localize as well. And when you have more hearing loss and it goes further down the chart, and those inner hair cells and the outer hair cells become affected, more trouble localizing to a sound. Can't even tell where it's coming from. And then the last thing, susceptibility to noise interference. That's the big kicker, right? You can't filter the words from the background noise. And that is physiologically something that is breaking down. And that is the reason that we all want, turn down the background noise, right? If you just turn down the noise, I could hear you. Well, what we're doing is we're saying, separate the words from the background. Make it louder so that I don't have to work as hard. But physiologically, the brain's ability to filter is not there. And that is the frustrating part. And that, again, is where the assistive devices, right? When this group is great about trying to encourage you to use assistive devices, use TV amplifiers, use microphones when you're in a noisy environment, use the loop system at home or in areas of public venues. That's one of the things that Tony and the looping is trying to do, is to make it so that there is less interference and that the voice comes up over the background. And those are things that you can really work to improve your comprehension, is by using assistive devices. In this group, the majority of you have a hearing loss that's probably at the moderate level or below, because I would know that because you're coming in for support. You're coming in because you need help, because a hearing aid on its own is not doing the job. Not doing the job. And the thing about that is, as we talked about, you know, I don't have that silver bullet that you're going to put in and make it work, but we do have a lot of tools in our toolbox. And that's really what I want to encourage you on today. The last thing that it says down here is, the more hearing loss you experience, the greater the difficulty the brain has in processing the sound input. And we touched on that a lot. But what I also want to say is that if you go back to the idea about a television, and remember the old VHS days when you had to use your antenna and you had to try to get the shadow away. That's really what we're trying to do with hearing, is we're trying to give the brain as much information as it can so that it's lined up with what you're hearing. So ways to improve the process. We talked about the communication strategies. I talked a little bit about hearing aids being smarter and accessories. There's assistive devices, which are your helpers. And again, this whole group is about all of those things. It's about support groups. And then there's also individual help that you can do for yourself. And some individual help you can do hearing therapy. If anybody has a smartphone, there's an app that is free, and it's called Hear Coach. So if you look at that and you go into your app store, you can download it. It's from Starkey, and it's free. And what it does is there's 5 different levels and 3 different games that you can play. And what it does is it gives you stimulation so that it'll say like the word box, and it'll have 6 choices. And you have to pick what you just heard. And if you get it right, you get points. And then it goes up the various levels and it gets more difficult. It starts adding background noise. And the reason that this therapy works is because it's giving you intentional listening. You are intentionally listening and saying, that is box, and it's not bot or bach. And you don't realize it, but intentional listening is what we do when we are little children all the way as we're growing up. Just like the Ista Duma Spachtico Pustaguava doesn't mean anything to you, when you start having hearing loss and the message is not coming in as complete, the brain starts losing its sensitivity. And what you are doing by your hearing therapy is you are going back and strengthening the neural connections in your brain on comprehension. And it works. It really does work. If we didn't think that therapy worked, then why with a physical therapist do we go there after a knee surgery when we know how to walk? Right? Why do we go to a therapist? Because they have intentional information to help us improve our bodies. And in the same way, that is what's lacking in hearing aid distribution and coverage, is the therapy on the back end on how to improve your comprehension skills. The reason for that goes way back. Jim's here from Jim Lane. He'll be able to kind of support it. But back in the 70s, the Hearing and Speech Association which is my national profession. I am an audiologist, which means that I have a master's degree, and now it's or higher, because now you have to have a doctorate in audiology. You have to have 8 years of college to be an audiologist, starting in 2007. So I was grandfathered in 2007 with a master's degree. But I am an audiologist, and in addition, I am a hearing aid dispenser. So I'm called a dispensing audiologist because I do both. However, not all audiologists dispense, and not all hearing aid dispensers are audiologists. So just to kind of bridge, because there's some communication issues there, people get confused. But as an audiologist, my 6 years of college is all, the undergraduate degree is on speech pathology and audiology. So my undergraduate degree is speech and audiology, and then at the master's level, you could choose speech or hearing. But it's all about therapy. It's all about rehab. And that is the part that I just love, and it's the part that's missing when it comes to hearing aids. As I said with a knee replacement, a doctor would never say to you, you know what, you just got a knee replacement, you know how it works, you know how to walk, just give it 6-8 weeks, you'll be fine. You know, if you have a little pain, come back and see me. No, you go see a physical therapist 3 times a week for 4 to 6 weeks after a knee replacement. And when it comes to hearing aids, the reason that the majority of people do not accept their hearing aids is not necessarily because they're not fit correctly. That can be an issue. And there's a couple tests that should be done, and I have it down there under hearing aids, but in the essence of time, we won't talk about it right now. But the thing is that you need the counseling and the rehab. You need to be told the expectations. You need to understand that the brain can be rehabbed. It has neuroplasticity. And if it didn't have neuroplasticity, which means it can adapt, then why would we do speech therapy, right? Somebody have a stroke, we teach them how to talk again. Well, how does that happen? It happens with the way that the therapy is performed and the comprehension of the brain. Not all the time does it come back, and it has to do with the way that the brain is damaged. But it's the same thing with hearing. Hearing, comprehension, and understanding can be improved significantly. Not only through the outside factors of what we talked about all morning, but the inside factors. You can practice it. And one of the ways you can also practice, that I have on here, is LACE, L-A-C-E. That stands for Learning and Communication Enhancement. It is a therapy that has been proven to improve comprehension and noise up to 40%. It is sessions on the computer of you listening and practicing and working to improve the comprehension. And there's only 20 sessions or 11 sessions. I give 11 sessions free with every hearing aid fitting because to me, it is so important to do. And people will say, well, I did the 11 sessions and yeah, I improved a little bit, but what about now? Take those skills and keep working on them. If you get the CD, which is normally $99 online, we sell it for $89, but if you do the CD, which is 20 sessions, you get 500 days of therapy on the back end that you can do. 500 days, you get a year and a half of therapy for $89. You're a pretty busy guy. That's a pretty good deal. And it helps. So it's just like going to the gym with a physical trainer, right? You work with the physical trainer, you do better, and then afterwards, you use those skills on your own. So the bottom line is that, yes, proper fitting of hearing aids is a factor, but it's not the biggest factor. The biggest factor are those 3 pieces of communication. They are also knowing yourself, knowing your hearing loss, making sure your hearing aid is set to the best of its ability, using the accessories, and having a positive attitude. Because just like a normal listener, sometimes my communication can be ineffective, even though I'm sending the best message possible. There's so many factors to be included, and what we need to do is just be realistic. So thank you very much for the chance to speak this morning, and if there's any questions, I will field them.